This is Doug Field along with my co-host Brent Macy, and welcome back to this second segment of Healthcare Consumers and Radio. We're really pleased to have our guest today. He represents the National Association of Worksite Health Centers, which is really all about the trend where more employers, even streaming down to mid-sized employers, are utilizing on-site health services and actually setting up on-site health clinics. And Larry does understand the employer's perspective because he's also CEO of the Midwest Business Group on Health. So welcome to this program, Larry Boress. Larry, good morning.
Good morning. You're somewhat faint. I don't know if you can increase your volume, but it'd be easier for me to hear you then.
How's that, Larry?
It's a little bit better.
Okay. Hey, welcome to the program. Give our audience kind of an overview of the National Association of Worksite Health Centers and the kind of work you're doing.
Sure, it's a pleasure. This is an organization that was begun based on the interest of employers who sponsored on-site clinics to find a neutral nonprofit organization where they could benchmark, they could exchange information and experiences about designing and building centers, comparing vendors, etc. Began as actually a series of roundtables for a couple of years that employers nationally just got together by the phone and in person, just asking each other's questions about how they did different things. And so ultimately, in the end of 2011, the National Association of Worksite Health Centers, or NAWHC, formally incorporated. It is an affiliate of Midwest Business Group on Health, but represents and serves employers nationally. It assists two kinds of employers, or I should say vendor clinic sponsors, a group of employers who are interested in exploring whether having an on-site clinic or wellness or fitness center makes sense as a business strategy, as well as for those employers who and unions and other groups that have centers to determine how to best get their greatest value and expand these to integrate with the other things they're doing. So NAWHC offers educational programs, networking, benchmarking services. It also supports information exchange between those organizations and identifies different resources to help employers in these efforts.
Larry, this is Brent. When you look out in the marketplace, obviously with the healthcare law that is, kind of moving down the road, there's going to be a tremendous access to care problem possibly in the market. Does that increase the appetite for an employer to really look at putting an on-site health service, at their workforce or at their workplace?
Oh, absolutely, absolutely. I mean, when we know in January 1st, another 30 million Americans will have coverage, which means they will have the ability to seek out primary care and other services. And in many parts of the country, it's already hard to get in to see a primary care physician, internist, family practitioner, etc. So employers are finding that by offering some form of on-site services, whether it's acute care, convenience care, condition management, whatever, that you can then help your employees and their dependents be assured of having the care they need for the everyday problems and the conditions that they're trying to address for themselves. So it clearly is an added benefit for that. And it's surprisingly, even in large metropolitan areas, we're seeing employers put on-site centers in their office buildings. Even though there's plenty of physicians in the community, the real focus here is on productivity and reducing the need for outside services. We find in our surveys that if an employee has to go off-site for a flu shot or to pick up a medication or have their kids' ears checked, they're gone anywhere from 3 to 4 hours. They go home, they feed the dog, and then maybe they don't come back to work at all. But if you offer some level of services at the work site, you can increase productivity, reduce people's time off, and clearly reduce the need for paying for outside services.
Larry, are your surveys also showing and your work also showing that on-site health services really improve engagement in a company's wellness population health management programs?
Yes, absolutely. As we've done a variety of focus groups of employees and working with employers and even health coaches, what we're finding is that electronic coaching or even by phone is very difficult for many people, and many people actually don't want to hear from someone that they can't connect to, that they don't know who is who's calling, where the information is going. But having a face-to-face person to talk to can make a huge difference in getting them engaged in maintaining their own health, staying on their medications, and understanding what other benefits an employer might have that they could utilize, and even to the point of getting flu shots. We actually believe in having an on-site health center, as we call it, not a clinic, but a health center can be the hub of the wheel for all the wellness and condition management program an employer offers.
That makes a lot of sense.
Now, Larry, when you look at these on-site health centers, what is the typical offerings if I'm the employee consumer coming in there? What can I kind of expect to see?
Well, it really varies all across the map. We have employers as small as 200 having some level of a nurse practitioner, physician assistant, even an EMT, offering basic first aid, flu shots, blood pressure screenings, etc., for maybe 20, 30 hours a week. And then on the opposite end of the extreme, we have employers offering a full-blown primary care medical home with physicians, imaging services, physical therapy, acupuncture, massage therapy, full-blown retail clinic, etc. So it varies tremendously based on the needs of the local population, the space available, what the employer wants to target and accomplish, and, of course, their resources.
Do you see, there's a lot of talk across the space about telehealth. Telehealth is a very realistic, I think, access solution. Do you see telehealth being integrated into some of your on-site health services, so when that employee and their family is not at the work site, they can access a telehealth service?
I see telehealth focusing more on where there's locations an employer has where it doesn't make sense to bring in a health provider, and so oftentimes they will have a kiosk set up or set some kind of arrangement with the internet monitoring or monitor, so that information and provider services can be done over the internet or through video or through some kind of monitoring device, perhaps with a nurse practitioner or even a nurse assistant in the room to connect people with vital information and devices. What we're seeing is some of the vendors are offering kiosks where people can just walk into and type in their confidential information and actually talk to a physician or be seen. We're seeing some companies doing teledermatology and behavioral health services, and really there's a whole spectrum that can be done. But most of the centers are not using, at this point, devices where people would go take it at home and monitor their conditions and such. When we talk about telehealth, it's primarily being able to serve distant or small employer-size populations and connect that to the on-site center or whatever program they've got.
Okay. Larry, for our employers who are out there listening right now, can you kind of walk them through kind of what the process is if they're looking at putting one of these on site for their organization? Kind of what should they analyze, and how do you kind of help them know if this is a good solution for them to put in place?
Oh, absolutely. There's a number of key decision areas you've got to have. First of all, it's objectives. What do you want to accomplish? Are you trying to reduce people's time off work, going to outside providers? Are you trying to reduce your overall cost of services? Are you trying to increase your productivity? Are you trying to improve the health of the population? Are you trying to get people more engaged? Are you trying to be the employer of choice and improve your retention and improvement? So there's a variety of things, and it doesn't mean they have to be only one or two, but clearly you've got to know what you want to accomplish and why you want to do there. You want to then find out, well, do you want to do this yourself or do you want to contract out? Because about 40% of the employers are doing it all themselves. They're hiring the staff, they're setting up the facility or the room, they're identifying the services, etc. The other 60% are either contracting with an outside vendor or a local health provider, a hospital or medical group to decide, do I want to manage it? How do you want to have the providers? You then got to decide what kind of services. Is it going to be preventive services? Is it just going to be acute care? Is it going to be primary care services? Do you want to offer retail pharmacy services and other types on the work site? The range of services you want to have. It may also be decided by how much space do you have. Clearly, location is key. If you have something in the factory floor, for example, it's generally generally not safe or secure or confidential for people that come from the outside. So you generally want to locate this at the perimeter of the employer's location. And then how much space do you have? Do you have just a conference room, or do you actually have 1,000 square feet or more that you can develop? Now, what kind of staffing do you want? Do you want primary care physicians? Do you want nurses, EMTs? Do you want a full range? How do you want to do that? How many hours do you want to be open? Do you want to be open just during the workday? Do you want, if you're on 24-hour shifts, do you want to offer it during times? What do you do about weekends and evenings? Many of these have some relationship with local providers. You want to determine about cost sharing. Are you going to charge for it? 60% of the employers in NAWHC don't charge anything at all. No copays, no deductibles. They don't charge for drugs or any of the services because they want to get people to utilize the center. But other employers, 40% charge something, usually a small copay, so people have a skin in the game. You want to find about the information. An employer can't get involved in a health site center or any kind of wellness programs if they don't know what's going on in their population. So are you able to consolidate the data from your workers' comp side, group health side, HRAs, claims, et cetera, so you can see it all, because the on-site center could be the core of all your data. What other services do you want to have? Do you want to have physical therapy? Bring in mammography. Bring in other kinds of services. And lastly, and perhaps most importantly, how are you measuring this? There's about 7 different ways we can measure this, and we can talk about that in more detail later. But if you don't measure it, there's no way to know whether you're really successful in the first issue, which is what are your objectives and are you meeting them?
Larry, we'd love to have you back on another segment. We got about a minute left on this segment. Kind of wrap this in a bow for our audience out there. How they can find you guys and kind of 1 or 2 key takeaways.
Sure. Again, you can look at our website, which is worksitehealth.org, or you can go to our NAWIC LinkedIn group, the National Association of Worksite Health Centers. Be glad to answer any questions. My email is lboress@worksitehealth.org. Again, this is we have employers as small, as I said, as 200 and as large as over 300,000. Any employer who has a population where they want to avoid outside costs of people going to emergency departments for basic care and primary care can offer these kinds of services. There's a lot of vendors, and there's a lot of opportunity here, and it only can be expanded more and more, and particularly you can include dependents. So it's a strategy any employer should look at if they want to reduce their cost and improve engagement and the health of their population.
Well, thank you so much for joining us, Larry. Have a great weekend, and to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.